that it's very telling to me that the younger populations, that the numbers are so high. Because as some of you, and I know Karen, you know this, that HIV/AIDS education is mandated in the state, but there's nobody from Department of Ed that's checking up on that and making sure that our young people are getting that information. And there's also no sex education mandate. So I don't know how you talk about HIV and AIDS without talking about sex. I've been asking myself that for over a decade, but that being the case, I just think it's so telling that our young people, even in that like 20 to 24 age range, have such high incidence of HIV. I don't know if you wanted to talk just a little bit more about what you're seeing there.
Well, that's, one of the most important things, because it is so hard to get into the school system. Because people don't, the principals and teachers are afraid to allow you to come in. If you say one thing, and somebody goes home and say, oh, a lady came to us and she talked to us about HIV and condoms and stuff, and then the parent is calling up to the school, probably the same parent that knows that their child is having sex, but and so it's like, we know that young people are having sex, but it's just like a taboo topic. And so one of the things that I'm really trying so hard to do is to reach out to parents. I have this little parenting tip sheet. I don't know if you can see it on the camera, but this is something that I created, for parents. But just finding places to give it out. I was able to go to Wetumpka High School and give that information out at their like open house. So again, that's why I love opportunities where I can be, in front of people that do this work, so that you can know, hey, okay, well, they can come, I can sit at a table and I can give parents the information, so that when they do get a permission slip and asking, hey, can your child participate, in this? Because basically what the school wants you to do is talk about the science of HIV. Okay. But the science of HIV is not necessarily the reality of what we see. And so, as I said, in the work that I've done and working at the health department, especially, seeing young kids come in there, skipping school, or, missing school, or having their parent bring them or whatever, it's a problem. And so, and it's, with condoms, because what young child is going to ask their parent, um, who can you give me some money to go buy condoms? Somebody just said something. I was trying to read it from a school nurse. What?
Oh, Karen, your camera dropped again.
Oh, okay. So I have to, I'm sorry. Hold
That's okay.
on. Someone said it's so frustrating from a school nurse standpoint. I wish there was a way for us school nurses to collaborate with you. We have to be real about this. Absolutely. And I was just at a school several weeks ago, and basically just asking, can I put some STD facts for youth pamphlets in the school counseling center or with the nurses? And it's like, well, I got to talk to this person and I got to talk to another person. So any, anyone that has a contact in the school system, where we can go, because we do use age appropriate materials. We do use evidence-based materials, and we all um, we promote abstinence. But the program that I facilitated, it was called an Abstinence Plus, which means we promote abstinence, but we also talk about prevention, because a person is going to do whatever they're going to do. So we talk about prevention as well. But even just character building, and children nowadays, they are up against so much with social media, body image. It's not just girls, but I do think girls are more adversely affected maybe than guys. Also too, children struggling with gender identity and not really knowing where to go, for help. And so really, it has really been a struggle getting into the schools, system, because we all know that if you are well, emotionally well, physically well, sexually well, you'll have better academic outcomes, you know. But if a child is worried about, I may be pregnant, they're not going to be in school focusing. Or if they're worried about, I may have a STD, and then what happens is it usually gets so bad that they can't help but tell the parent, because then they have to go to the doctor, or to the emergency room. So, we have got to be as best advocates as we possibly can. I've been invited to a church to do HIV testing, but that they don't want me to bring condoms. So you are aware that people are having sex and possibly may have HIV, but you don't want me to bring condoms so that they can get them for free. But you don't mind me sharing resources to tell them where they can go and get them.
Right.
It's like,
Well,
hey, I'm gonna give you this cupcake, but you gotta go down the street to get the icing. So, you know,
well, and that's so true about you mentioned that you use an abstinence plus curriculum, and we are finding even now that there are factions of people that are uncomfortable even with abstinence based or curriculums. And I think truly we are getting to a point where people just don't want to talk about sex at all, and they don't want their young people to hear about sex at all.
right.
And it just makes it like it doesn't match up with the reality. It doesn't match up with the statistics that we see. We're an organization that our approach is comprehensive sex ed, and so what that means is we talk about abstinence with some populations. If that is age appropriate for them, is that if that's where they are, then that is appropriate. Like, let's absolutely talk about abstinence. But for populations, older youth or youth that are already engaging in sexual activity, they need the tools to know how to protect themselves. They don't need to hear about the benefits of abstinence if they're already having sex. I mean, I guess you could still give them the benefits of abstinence, but they're already engaging in these activities. We need to give them the information that will truly help them.
Right.
It's a frustrating time to be in this work. I'm sure
It
you know
is. Yeah, it is. And women, we have to empower women out, create sisterhoods where women are empowered and comfortable, talking about it. It's like we'll get on the phone when we meet this nice guy and be like, oh my goodness, he's so cute. He got this job or drives this nice car or whatever, whatever. And then we may talk just to our girlfriends, but we got to be empowered to say, hey, don't forget to ask if he's been tested, you know what I'm saying? Or make sure before y'all make that next move, it's kind of like, letting your girlfriend slip hang and don't tell her, your slip is hanging, it's like, no, we have to be that girlfriend that says, hey, stop,
Yeah.
before you move any further, and be okay, with that. And I find a lot of women who are, I am 55, but I'll say, I'll be 55 in a couple of weeks. But when I go out and do health fairs, I see so many women who say, "Oh, what are those? Oh, I don't need those. I don't
Mm.
need a test. I've been married for 15 years, or I've been, and I'm like, okay, so what bubble are they living in? So we have to not trust someone more than we trust ourselves. And we have to be empowered to do what we need to do for ourselves, and also to be able to pass that on to our young girls, and talking to them about health and hygiene, caring for themselves, making them feel okay with short hair or long hair or light skin or dark skin, and helping them to be okay with who they are naturally. So, and I know there are a lot of cultural differences and, economic, socioeconomic differences and barriers and things like that. But for us who are doing the work, we can't we can't be afraid to be advocates for the people that we work for. Um, and I say that because I tell people I've done a presentation on advocacy, and I say I have to be an advocate 24/7 for people living with HIV. And what I mean by that is if I'm off work and I'm at the dinner table with some friends or whomever, and they say, "Oh, you work with them people that got AIDS." No, I
Hmm.
work with individuals who are living with HIV,
Yeah.
and have to correct them, um, and so that's me being an advocate, just like me being an advocate for a homeless, person. So we have to be advocates, and we you can't do this work and not advocate for your people.
Well,
I
and
just
yeah, you're just like, you're always going to be the one at the dinner table or at, the dinner party or wherever you are that is like the squeaky wheel for your people. And
mhm,
that's a good thing. I think a lot of times, we get in our little bubbles and people say things, and a lot of times we just will let them say what they're going to say. But we can really be advocates, and especially when we have that relationship with somebody, I think we have a better chance of not necessarily changing their minds, but helping them see a different
mhm,
perspective than they might not have. Like, they might just be ignorant, and not in a bad way, they just don't know. you know
right,
like, we don't say people, people with AIDS or whatever, because like it's not 1980 anymore.
right.
Know so much more now.
Right, exactly. And that brings up another important point too, because I did a training in Mobile, and I thought it was very interesting because they set up little timelines, and they ask you questions about like what did you know about HIV in this era.
Mhm.
Like 1986 is kind of like where they started, and then they moved up, like did you know anybody um that was HIV positive, or anybody that died, what I'm saying, from HIV related complications. And I looked at the population, our priority population as youth right now. They are really ignorant to the history of HIV.
Mhm.
And so I think with that, they don't know from whence we've come,
Yeah.
with treatments, and how people at one time were just literally wasting away
Yeah.
because people didn't know they were being shunned from society, like the plague,
Yeah.
and I thought about how when COVID came around, how that could have brought up some trauma from people, some older people who are aging and living with HIV, that come from back in the time when nobody wanted to touch them, and how that may have, affected them. And so we don't really think about all of that and how that impacts, society, and the stigma that's associated with it, and how important it is for us to help, remove the stigma. Um,
Well, and I think that,
HIV.
one piece that's missing is that so many people, especially so many older LGBTQ people, are missing from our society because they did die. Like, we don't have those elder folks in the LGBTQ community because so many of them did perish in the AIDS epidemic.
Mhm.
And so we don't have them to let that can pass down that history.
Right.
Um, but it was truly this horrible thing, where they were just left to die and in the hospitals and without care, and nobody would touch them. And you know um, it was like a remarkable thing when these hospitals began to have AIDS units where they had nurses and doctors who
Mhm.
would care for them in a human, like in a human way. So we have come so far, and I think that is a history lesson that is lost.
Right.
Yeah.
Well, I'm working on a little project that's primarily geared toward women.
Hmm.
And it's some little sessions that will be called Pillow Talk.
Okay.
And I'll be working on trying to get, small groups of women together to have those uncomfortable conversations, and just for us to connect and have, conversations, because in what I see with women. So I would, encourage those of you who are on the call, if there are some specific projects that you can maybe create with women and girls, or with just women, or with just girls, maybe that you try it if you need some ideas, or if it's something that you would like to do to collaborate. Um, when we go on college campuses, girls will get tested, but guys won't. And
Mm,
girls will get condoms, but we have to like coax the guys,
yeah.
to get them. So we always, whenever I'm out doing such, I'm always see more women, more young college age women. They will get tested, but older women don't want to get tested.
Yeah.
So we gotta create opportunities for them to promote testing. And there are a lot of single ladies out there who are middle age,
Mm.
and we gotta, send that message that it can happen to any one of us.
I
So
mean, I think there's even like the resurgence, this has been several years ago, but I feel like there was a resurgence even in nursing homes of STIs. I don't know so much about HIV, but for sure, like STIs would run through these nursing homes. And it's like, human sexuality is human sexuality. We are all
it
sexual
is.
beings. And even when we're older, we're still sexual beings, even if it slows down a little
Right,
bit.
right.
But if
And
you're
it's
widowed
okay.
or you're
Yeah,
single in an elderly community, like you're still going to be interested in sexual relations, and you're still at risk for maybe not pregnancy, but
right.
STIs
And
and
it's
HIV are
okay
still
to say the
real.
word, yeah, it's okay to say the word sex. When I
Yes.
go out and do presentations, I was like, okay, y'all, let's say, everybody say it loud, to make it like, okay, it's part of who we are.
Yeah.
Let's talk about it, in a positive way. So,
I keep
um,
saying this to like everybody I'm talking to recently because I just thought it was really clever and funny. But it was something I saw on social media. But it said, "Sex is like the most normal thing that humans do besides laundry. So let's stop being weird about it." And I just think that's funny
it
because it's
is,
so. I
yeah,
mean, it's just so true,
it's
right?
true.
Yeah,
It is,
like
it
we do
is,
laundry
it
every
is.
week. A lot of us
Right,
have sex every week.
right, exactly.
And it's
Well,
just a normal thing that human beings partake in, and let's talk about it. Stop being so weird about it.
right. Well, thank you so much for the opportunity today. I can't see everybody's smiling face, but you all can see mine. And I
Yes,
do hope that the information that I've shared um, uh, will has been helpful,
yes.
to someone. Are there any last questions, comments, or feedback? Megan, you've been real quiet. So
I did want to just ask Karen if you could drop your email in the chat so folks could take it if they need to reach out for resources or to have you come do the testing on site for them. That would be
okay.
super helpful.
I just have to the wait there. Wait a minute, there it is right there. Okay. Well, let's see.
Or you can tell it to me and I'll drop it in the chat,
I got
whichever's
it.
easiest. Okay.
I was just gonna say, it seems like maybe we have some educators or like school nurses or teachers on the call. So I was maybe it would be like useful to talk a little bit about like what we can do in this political climate. Like I guess because like we see that young people are desperate and needing this information. And when you were talking about the like excuse, like I'm married, I don't need to worry about this. I was at a conference for high schoolers last week in Montgomery, like with high schoolers from all over the state. And I had a high school student come up to me and be like, I'm married, showing me the ring on his finger, and be like, I don't need this information. And so it's like very clear that that young people need this information. Like that table was like flooded. People were so excited to be like learning about sex ed. But like because of parent pushback or politics, whatever, we're like
Right.
having a hard time talking about this without fear of losing our jobs as educators, especially in the public school sphere. So I was wondering if maybe you had like any tips on like how to sort of like covertly talk about this while protecting our jobs, or that kind of thing. I don't know if that's relevant for everybody here, but
I'm sorry about the email, y'all. I just got a new prescription this morning for my
Oh,
glasses.
bless your heart. No, that's okay. I just knew it was Five Horizons. I didn't want to like call you out
No,
on
that's
it, but I
fine.
just
Thank
wanted
you. I
folks to.
apologize. Well, it it is very difficult. And I get, sometimes, we all need a job. Of course, I don't want anybody to lose their job. But sometimes we have to really just like have a sit down conversation with, the person. And of course, we're not going to always be able to break through, with them. But I think my thing is, if I can just get into the room with you and talk to you, I think that I think that sometimes I can, change a person's mind because, more than just talking about sex, I'm talking about character building and how to, avoid peer pressures and different things like that. And it all does have to do with sexual health. The goal is to get them to be able to stand up and be empowered, for themselves. So it's really like, it's but we can't like sugarcoat everything. um and so we do have to be careful in our language, and I definitely understand that. And I am, and I've had, when I did go into a school, I sent an outline of what, we would discuss. So I'm very cautious and careful, in how I talk, um, you know, to students in high school. Me personally, I really don't like to do middle school because they just a real tough age, to my
Shout out to the
conversation.
middle school teachers because they are a tough age, but they
Yeah, and
need
I
this
really don't
information
know what to
too.
say to them,
So
college age, you know, is college age, of course, is easy, for me because I can pretty much discuss, what I need to discuss with them. But I think that just, anybody that knows somebody that you think that there can be a breakthrough with, because sometimes it just takes one. And even, breaking barriers to the faith community, people believe in their worship leaders. And so, there's got to be a breakthrough. Finding champions is hard. But I guess it's just always going to be a work in progress. But and I'm always open for some tips and strategies. So
well,
I'm
this
good.
isn't a tip or a strategy, but I just do want to remind folks that are on the call that we did a survey. It's been since 2017 now, so we really should do it again with today's political climate. But back in 2017, the majority, like super majority of parents with school age children really supported sex ed and supported talking about condoms, supported their young people learning about birth control options, how to communicate with their partners. Like we're talking like 80-90% in all of these topics. So not a small majority, like a huge majority of parents really supported these things. And I know we're in a different political climate now, and so that those numbers probably would be different these days, but I think that by and large parents are pretty real and they understand. I mean, there's always going to be those loud parents that they want to be the only ones that are talking to their kids or not talking to their kids about sex.
Right.
But there are more of us, I can say as a parent, more of us that want somebody else talking to our kids. And hopefully then, I can be reinforcing a similar message in my home about protection and being in healthy relationships, et cetera, et cetera. So
Right.
all
Yeah.
that to say, we can be advocates in that way as parents as well.
Right.
Yeah.
Well,
Well,
thank
thank
you
you
so
so
much.
much, Karen. This has been wonderful. I love a more casual conversation. I really appreciate that everyone jumped back in. I
Thank you all
apologize
so much.
for the technical issues. We will have them sorted before our April webinar.
Okay.
But thank you so much. And just as a reminder for anyone who didn't hear at the beginning, we have Advocacy Day on April 6th. I don't know if Megan, if you can find that link real quick to drop into the chat. Sorry, just sprung that on you. But if you can find that link, we will be in Montgomery at the State House talking about the importance of sex ed. If you have young people that would be interested, we can provide a school note. So April 6th is a Thursday. So really looking especially for those high school and college age young people to come up and talk about why sex ed is so important for them and their peers. And then next, our next webinar will be on consent and college hookup culture from somebody, from a professor at University of Alabama. So that'll be the second Tuesday in April, and we hope to see you there. So thank you, everyone. We can also follow up with an email, Megan, with both of those links. That's probably the better option. So we will follow up to everyone with an email with both of those links as well.
All right. Well, you all have a great rest of the day, and if anybody needs to reach out to me, feel free.
All right. Thanks, Karen. See y'all later.
You're welcome. You all have a great rest of the day.
Bye.
Okay, bye-bye.